Positive symptoms of schizophrenia include hallucinations. These are sensory experiences that are not comprehensible to others but feel perfectly real and vivid to the person experiencing them.
Roughly 70% of people with schizophrenia will have hallucinations. Auditory hallucinations, hearing voices or sounds that aren't there, are the most common, affecting more than 83% of patients, followed by visual ones 57%, such as seeing body parts or unidentifiable things.
Other, less common types, 27%, of hallucinations include tactile or sense of touch ones, such as feeling bugs crawling on your body. Olfactory or scent-related hallucinations, 27%, and gustatory hallucinations, 14%, which involve your sense of taste. No matter what the type of hallucination, a person with schizophrenia can't be talked out of it or convinced that what they're hearing or experiencing isn't actually happening. Delusions. Defined as false beliefs or beliefs that conflict with reality. People with schizophrenia hold strong to these notions despite plenty of evidence to the contrary. Delusions come in many forms. Some of the more common ones include delusions of persecution. The belief that someone or something means to do you physical or emotional harm, like believing that your next-door neighbor is entering your home while you are sleeping in order to poison your food or to spy on you. Delusions of grandeur. The belief that you are an important, powerful, or a famous person, such as a member of royalty, a deity, or a superhero with special powers such as an ability to know the future. Delusions of reference. The belief that something or someone is referring to you when they are not. For instance, you may believe something you read in the newspaper refers to you or your thoughts, or that an actor talking in a movie is sending you a personal message through the screen. Thought insertion. The belief that your thoughts are not your own, rather they were placed there by an outside source. Thought broadcasting. The belief that your thoughts are being broadcast so that someone or something can observe or collect them, say, aliens or the government, or that people around you can read your mind. Thought disorder. This is a disordered way of thinking where it's difficult for the affected person to keep their thoughts in a linear, organized way, says Dr. Margolis. As a result, words and phrases are misused, underused, or overused, and it's difficult for another person to understand. For example, a person with thought disorder might respond to a question like, "Where are you from?" in a tangential, irrelevant way by explaining they don't know their ancestral history. Or they might derail off topic with a flight of ideas that are only vaguely associated with the original concept. Disorganized behavior and speech. This is characterized by trouble with goal-directed behavior, which can not only get in the way of starting and completing a task like making dinner or getting dressed for the day, but it can also impact your ability to work or interact with others. Speech can also be affected. Words may become so jumbled and confused that it's often described as a word salad. Other ways disorganization can manifest: a decline in overall daily functioning, unpredictable or inappropriate emotional responses, lack of impulse control, bizarre behaviors that lack purpose. Routine behaviors such as bathing, dressing, or brushing teeth can be severely impaired or lost.